Up until less than 2 weeks ago, you could only fill a prescription for 1 month at a time. The concern was drug shortages during the height of the COVID-19 pandemic. The province has since lifted that recommendation, but now local pharmacists say they weren't given enough time to prepare for the high demand and fear drug shortages once again.
Here's an example of a blood thinner. We're trying to order it in for our patient, and like we've seen so many times, it's completely unavailable across the board. And this happens every day, every week, every month.
This isn't the only drug shortage Cloud Pharmacy and others in the province are dealing with right now.
Whether it's respiratory meds, anxiety meds, antidepressants, blood thinners, across the board, because this was already happening before, COVID just exacerbated this problem a great deal.
Pharmacy manager at Cloud Pharmacy and the VP of Communications for Pharmacists Society of Ontario, Joseph Anu, says the reason for the shortage is simple. The drug supply chain was already stressed before the pandemic, and there's a decrease in supply right now because the ingredients used to manufacture drugs mainly come from China and India. Fanu says the province didn't give pharmacists enough of a warning that they would be lifting the recommended 30-day supply limit for dispensing medications. Even though Fanu says there's a shortage, the Minister of Health and Long-Term Care's office says the supply chain of many, note not all, medications is stabilizing. They add this will be more convenient for seniors and vulnerable citizens, writing in part, pharmacists are responsible for managing their inventory appropriately and should continue to use their professional judgment to determine appropriate quantities when dispensing drugs that may be at risk of shortages. Fanu says the provincial system makes it hard to do that.
Right now we get a real shortage of information from suppliers and government and manufacturers. So when there's a shortage, a lot of the time your pharmacist is finding out on the spot as they're trying to make their next orders for their patients. Well, sometimes that's way too late. So what would be good is we know the information ahead of time.
What's the solution to addressing drug shortages here in Ontario?
We're not always given the tools to deal with shortages. So information is one thing. We want clear information ahead of time on when we might see a shortage. What are the stock levels now? What will they be in a few weeks, and how can we respond to them? Some of our neighboring provinces and other countries already have a system for dealing with that, which is the pharmacist will discuss with you and also inform your physician on there's an alternative medication that we can use in the meantime as a stopgap, and they can make that substitution, obviously, with consulting you.
The pharmacist we spoke with has this message for Ontarians. If you are healthy and don't require a 3-month supply of your prescription, then try to take a prescription of a month or two at a time. That way, those that are less healthy, less fortunate, or have less access to a pharmacy have a better chance of getting their prescription in bulk if needed. Maleeha Sheikh, City News, Toronto.